This is a Beggy Sisa podcast.
Actually, about half the people who have evidence of the TB organism in their sputum, if you go out and look and screen, don't feel sick like that at all. They actually might feel quite well.
Welcome to this episode of the Beggy Sisa podcast. I'm Joan van Dijk. Today I'm speaking to Emily Wong. She's a TB expert with the African Health Research Institute in Durban. I'm speaking to her to find out why the idea we've got about what the average TB patient looks like is wrong. She's going to introduce us to the new TB patient. So how does the picture of the average TB patient look like at the moment, and how does it differ from what we might have in our heads?
So it's very hard to say anything about the average TB patient because TB is one of these conditions that can present in a million different ways. But what we have been realizing recently is that the traditional image of a person with TB that we as a medical and public health community have communicated, and I think that most people in the public have heard us communicate, is that someone who has TB is coughing a lot, is feeling very poorly, has lost a lot of weight, is having night sweats, is having fevers during the day, and they're really quite sick. And what we've learned recently through research here in South Africa, the National Prevalence Survey, research that we've done and research that's taking place across the world, is that actually about half the people who have evidence of the TB organism in their sputum, if you go out and look and screen, don't feel sick like that at all. They actually might feel quite well. If you ask them if they have any of those symptoms, they say no. They haven't lost a lot of weight. They aren't coughing. And they might just be going about and doing their normal daily activities and not aware that they're that sick.
Many South Africans might be familiar with the idea of latent TB. So is subclinical TB somewhere in between latent TB and full-blown illness? Could you describe the difference between the three?
So we think that subclinical TB is someplace between what we call latent TB and what I'm now starting to call full-blown TB with all the symptoms in someone who's feeling really poorly. So briefly, latent TB is when you have been exposed to and become infected by Mycobacterium tuberculosis, which is the organism that causes TB, but it's living someplace in your lungs or maybe in your lymph node in a dormant, quiet, non-replicating state, and your immune system is containing it so that you're kind of in balance with that MTB organism and it's not growing. That's really what we mean by latent TB. And at that stage, you can take medication targeted for TB prevention and hopefully kill that organism and never hear from it again. Subclinical TB is a little bit of a different situation. We think in subclinical TB, it's progressed beyond latent TB. The organism is now replicating. It's causing some kind of damage someplace in your body, for example, in your lungs. It's growing. Your immune response is causing some pneumonia in your lungs, but it may not be severe enough yet or of the nature that it's causing you to feel very poorly, lose weight, cough, take yourself off to the clinic to be investigated. You may just be in a very early state living with your infection without being aware of it.
And would someone with subclinical TB necessarily go on to develop symptoms?
So that's a really good question and one that health researchers are very interested in, but I can't give you a clear answer to it. We think theoretically that some people who have subclinical TB will certainly go on to develop clinical TB if you didn't find out about it at the earlier stage. But it's hard to know the answer to those kind of questions because currently, if we do find out about it, in most cases, doctors would opt for treatment. And so you wouldn't kind of find out what would happen in the future.
And people would have become familiar with the term asymptomatic from the coronavirus pandemic. And we were very worried about asymptomatic COVID during the pandemic. Is it similar with TB? Are they also spreading the disease?
And this is a question that we would all like to know the answer to very much, but we don't exactly know, but we suspect that if someone has the MTB organism in their sputum, that it's probable that they could transmit that organism to someone else. But there's questions, if they're not coughing. We've always thought that coughing is something that contributes to the spreading of TB in the air. So if someone's not coughing, could they still be spreading it? There's some emerging evidence from Cape Town, actually, that much of the TB that comes into the air from someone who has TB just comes out of that person through regular breathing, tidal breathing, not from coughing. So that would imply that, yes, perhaps people with asymptomatic TB may be contributing to transmission. But the answer to that question is not really known. There's not very good data.
If a health worker thought that this was happening, what would they suggest to me if they thought that I had asymptomatic TB? Would I get treatment?
So currently, South Africa did last year, in response to an update to the WHO guidelines for screening to TB, as well as in response to the National TB Prevalence Survey, which identified the fact that there's a lot of asymptomatic TB in the country. The National Department of Health did release new screening guidelines, which do recommend that chest X-rays and sputum screening be done among asymptomatic people in communities or among groups that are thought to be at high risk for TB. So that work has started around the country, and people may see chest X-ray vans or health camps set up that are actually trying to help screen people for asymptomatic TB. And I think that's a really positive development. And I think our National Department of Health is on the right footing there, getting out and responding quickly. So it's possible that people could be diagnosed with asymptomatic TB through one of those efforts. And then, yes, people would be treated in most cases, because when someone has sputum positive TB, we do generally recommend that they take a course of TB treatment. Now, the hope in the research community is that it may be possible that people with asymptomatic TB might have kind of a milder form of TB. And we would like to start asking, could they take a shorter course of TB treatment? Would that be appropriate? But that will require studies to be done to answer that question. And those studies haven't yet been done.
If people were listening to this podcast and they hearing about asymptomatic TB for the first time, is there something they should be doing about it?
The easy answer is I think people should actually be asking us as researchers and as Department of Health to figure this out and to look into this, because it's obviously a relevant question. I mean, I was just showing some colleagues here some data about among all the people that we identified who had asymptomatic TB, 10% of them had drug-resistant TB. And I was showing them the actual data of some people have had pre-XDR TB, but they had no symptoms. And as we were sitting in the room, people started looking at each other like, should I be worried that one of you all have TB and you're spreading it to me here in this office where we're not wearing masks? I don't know if everybody putting their mask back on indefinitely is the answer, and I don't think it is. What I think the answer probably is that we should really have a sensible screening strategy, and we should start putting our energy as a society towards screening for TB, treating TB, giving people TB preventative therapy, and really trying to get control of the TB epidemic, giving it concerted energy, and hopefully rolling out effective vaccines soon and trying to tamp down this epidemic.
So somebody could go to their clinic and ask for TB preventive medicine?
Yes, we just actually received a brand new set of guidelines on treatment of MTB infection for offering people preventative therapy if they've been exposed to TB or if they're in a high TB risk group. So that should be rolling out even more than it already is in clinics over the next year, and it's very exciting.
I find it interesting that you mentioned the gathering of your colleagues where people seem to get suspicious of each other. And so whether we know how much the asymptomatic cases can spread the bacteria, at the very least it might spread the stigma. Do you have any thoughts about what kind of education the health department should be rolling out to give people the knowledge that they need about this?
If we think back to the kind of stigma that we used to have before we had antiretroviral therapy, and when people kind of equated HIV with very severe AIDS, there was very bad stigma around HIV, right? Because most people kind of thought at that time, before we had treatment available, that if you had HIV, you were going to have AIDS and you were going to die. As earlier treatment became more available, and as we started to move back and diagnose people when they were quite well, and people would go on treatment while they were quite well, and people would live completely normal, healthy lives, full lifespans, that's actually really helped us to change our collective idea of what HIV is, and to therefore decrease HIV stigma and increase testing and motivation of people to go into treatment. So I do think that as we change our thinking about TB, and if we end up moving our image of TB from someone who's very sick and is going to have post-TB lung disease because their lungs have been a battlefield for so long, and if we start shifting to an earlier image of what it means to have TB, it may help us in the end decrease stigma. But, this is a process and it doesn't happen overnight.
That was Emily Wong from the African Health Research Institute. That's it for this episode of the Becky Cesar podcast. I'm Joan van Dijk.
This was a Peggy Cesar podcast.